Hi, I'm Dr. Jen Kim. I'm a periodontist practicing in Southern California. Most important thing of all the list up there is the fact that I am one of the directors for the Seattle Study Club in Southern California. We are called the West Coast Study Club. I'm going to spend a few minutes with you talking about guided post-surgical healing, what we can do to do better to our patients so we can avoid these kinds of disasters that we see from time to time. I'm not going to pinpoint chlorhexidine as one source, but this is, I believe, very closely linked to issues like this. See, if we do not use chlorhexidine, for instance, we are under the fear that we may be getting a post-surgical infection of some sort. Here's a patient who presents 2 weeks after surgery, did not take the denture out, did not brush his teeth, did all the normal activities, but did not use chlorhexidine. But there's no infection per se. In fact, that white material in the roof of the mouth is actually dead skin, basically epithelium that sheds and piles on top as a result of not brushing. But we don't see a sign of post-surgical infection. In fact, would you like to pour some strong chemicals on a very delicate surgical wound like this immediately after surgery in the first week or two when the cells really need to do their job to heal? So let's really think about that. Chlorhexidine is a very popular chemical that we use for many different things. Unfortunately, chlorhexidine is a very, very effective chemical. It actually kills bugs very well. Unfortunately, it's a very effective chemical in that it kills everything that it comes into contact with, including the oral epithelial tissue that we want. So these are some of the uses for chlorhexidine. It's been used very widely in clinical dentistry for the past couple of decades. And chlorhexidine has this mechanism of use. Basically, when it comes into contact with the cells, and it doesn't matter whether it's bacteria or your host cell, they seem to attack the cell membrane to the point where the cell membrane bursts. And that's a very simple mechanism as to how it works. Pucher and his group back in '93 did a very simple study where they looked at the effect of chlorhexidine in different concentrations and tried to see what it did on human fibroblasts. To cut to the chase, when we dilute chlorhexidine, even about 60-fold from what is the normal therapeutic use that we use from the bottle, it still killed a lot of fibroblasts, and this slide is very disturbing. You see, our main target is this, the bacterial pool that we tried to kill, and one must convince each other that there's so much bacteria that all of our surgery is going down the drain. But the truth of the matter is it's not that much of an issue. In modern day, post-surgical healing is quite uneventful. So why are we throwing very strong chemicals? So let's look at some of the other effects like the cytotoxicity. And it's very clear when chlorhexidine is used, especially immediately post-surgical, it tends to affect the fibroblasts. And this particular paper shows that because fibroblasts are selectively killed off, the tensile strength of the wound, namely when the incision line is pulled, it rips open much easier in the early phase of the healing. So these kinds of studies have been available, and this is actually my mentor, Dr. Barry Kenny from UCLA. Their studies going back have shown time and time again that it affects other white cells and helpful cells that we really need in the healing process. Now, here is a classification of how our implants tend to open up. It is a category of different types of exposure, and many times when we encounter these kinds of unfortunate situations, most of the key opinion leader tends to say, well, you either have to open it up earlier on, or you may have to just use something like chlorhexidine to quell down the possible infection. But what are we really doing? Are we really helping the cells, or are we really disturbing the wound and making things worse? I think we really need to relook at this particular topic. I think chlorhexidine can be used in the following 4 categories. So post-surgical, as you realize by my bias here, I can say it's probably not the best thing. So do we have some alternative? And that is, once we have an acute injury, We want the injured site to have as minimal amount of inflammation as possible. Goes through with a lot of active fibroblast activity and other cells that come into the area and do their job, and together with good blood supply and nutrition supply that makes the wound heal well. Here's a good example. This is a typical type of surgery that I do on a daily basis that, frankly, is one of the most uncomfortable situations for the patient. It's what we call the free gingival graft, or what we normally also call expensive graft. It's where epithelial tissue is taken away from the roof of the mouth, and in today's world, we use platelet-rich fibrin or concentrated growth factor to serve as a wound dressing. Here, lots of things have been done in this patient. Implant was placed immediately. Gingival graft was done in the vestibular area, the facial surface. But let me show you. Here is some gel that we're putting on. It's actually a natural source. It is a commercially available gel called Stella Life. We tend to liberally put that on before the surgery and after the surgery, as a matter of fact. It comes in the gel form. And liquid rinse form. And this is a patient that we saw recently at a implant training program that I run in Tijuana, Mexico. So Maria Angelica just had the surgery finished. You can see the wound in the roof of the mouth as well as on the buccal surface of her lower right side. This natural medication was applied. It contains arnica and all kinds of goodies. And honestly, I'm not smart enough to even know what those ingredients are. All I know is that it actually helps the healing process as opposed to killing the cells that inadvertently we've been doing with chlorhexidine. This is a 24-hour post-surgical image. To look at it side by side, you might say, what's the big deal? It doesn't look any different. But here's the fact. Many of these surgeries do become quite uncomfortable. Swelling, edema is very naturally associated with injuries like this. And this is the roof of the mouth at 24 hours also. And here she is, the patient, Maria Angelica. Actually, I cut the audio down for this purpose, but she's actually telling us that the first 24 hours, which we expected to be quite rough, this was not only a brutal surgery, it was actually done by a trainee dentist who's not very proficient on this procedure. So you can imagine the surgery was a little more rougher than average. But despite that, at 24 hours, she's describing to us that it was not a big deal. It didn't hurt very much, and the gel truly did help. So I think there are alternatives like this on the market. I'm not going to go into the details of how to use it and so forth. I think you can visit the website of these friendly people and get more information. But the 3 steps that they advocate is a systemic spray under the tongue that actually causes an environment of anti-inflammation. We use it immediately before the surgery and immediately post-surgical. It is a natural ingredient so people can swallow it, and it does not tend to interfere with the healing. Here's my good friend Jason Stoner. Everybody knows Jason Stoner. He actually did a split mouth design study in his own patient in his own office. One side was Stella Life, the other side was chlorhexidine. Exact same procedure, alloderm type of gingival graft. The outcome was pretty much the same in terms of clinical variability. However, in terms of patient's pain, edema, redness, you can be the judge as to what the differences can be. This is a slide from Dr. Tack, an oral surgeon in the Chicago area, and he's done a pretty gross, significantly traumatic surgery, a cyst removal, and this is a 1-week post-op. And I can vouch for this because what I'm seeing since I've started to use this type of approach is that we're seeing like a 3-4 week healing in a typical 1 week, which is a much more accelerated response that people tend to see. This is a very common thing that we unfortunately do see from time and time again. Exposure of graft material, exposure of dermal matrix material, which can very quickly turn into a disaster. And in this case, just simply using this product tends to rapidly quell down the inflammation and somehow get you out of trouble, namely secondary infections. This is another case where a mucositis, lichen planus type of lesion, is healed simply by application of this type of medication. In fact, my sister has very severe autoimmune situation, diffuse inflammation, redness, erythema, and so forth, associated with pain. And she's been using the gel and rinse consistently, and she seems to be quite free of that. And there are many remedies, but this one seems to be very, very effective. So I'm going to get everybody to go up there and take a look at this material. Now, this is what I do in the office. Although the manufacturer likes you to dispense them out of your office, my personal philosophy is just, I'm not a retailer. I do services. I offer professional services. So I like to give people the products, but not actually sell them. So what I do, I incorporate this as a part of the surgical process, give them beforehand, and then give them the instructions to follow. But I do want them to know that I'm not getting these for free, because that's what a lot of patients tend to assume. When the doctor's office gives you something, they think, oh, they got it for free. They have truckloads of this. So I want them to see the value. So I tell them this is the actual handout I give to the patients and say, look, check. This is why I want you to use it, and go over the instructions. But I also tell them that you can buy these on Amazon. So if you run out of the first bottle gel, then go ahead and get it. Next day you'll have it on your doorsteps and start using it. And you know what most patients do in today's world? They look at the smartphone right in front of you and they say, wow, $30-something. And right there's a value added, because they're thinking, this is something I should use because it is worth it, and it is actually some dollar sign attached to it. So having said all that, is chlorhexidine still valuable today in clinical dentistry? So again, this back to this slide where these are the 4 predominant areas that chlorhexidine can be used. But I'm going to be saying that post-surgical use is probably not the most effective way of doing things. Then how about therapeutic? Therapeutic use. A recent article in the JADA has sort of put a final nail to the coffin for the so-called therapeutic use. You see, if you use chlorhexidine adjunctive to scaling and root planing or other non-surgical therapy, look at the vast literature out there that's been collected, the data that's been collected in various institutions over the past several decades, and the benefit is truly marginal, if that. So it's quite debatable, and the experts are now pointing to the fact that maybe this isn't that helpful. No benefits. So in my practice, I do not. The reason why I don't is treating periodontal disease is hard enough. It is a behavioral change that we're trying to provoke onto our patients. It's hard enough to motivate them, to get them to understand the etiology, the cause, and get them to be responsible and take care of their home care in a meticulous way. And we give them a half a dozen things to do. Why do you want to add another thing like a mouse rinse? And many people may overestimate the effect of the medication, and that might take away from their home efforts. So there's some psychology in there. So I try to keep things as simple as possible. Floss, use antiproximal brushes, do whatever is necessary, but let's not get them to rely on this magical potion. Therapeutic. It's very, very effective in the prodromal syndromes for aphthous ulcers, for instance. So I use it for that. Surface disinfectant. You see, this is something we do every day. We have things coming in and out of the patient's mouth. Cross-contamination might be an issue. And what do we use to surface disinfect things like this? That big jar on the right of the screen, which is glutaraldehyde. Now, I don't want to see glutaraldehyde in my mouth or my patient's mouth. I don't mind using glutaraldehyde to surface wipe the floors, the chairs, and all sorts of things you want to do. But if it's something that's going to return to the patient's mouth, say retraction, retractors or other instruments that go in and out of the patient's mouth, dental mirrors that we don't want to autoclip, then I think the better thing to use is actually chlorhexidine, because chlorhexidine is potent. It does kill germs effectively enough. So why not use something that can be put into human mouths when there's no wound, active wound? So why don't you use it for that? So we have little spray bottles of these in each and every room. So when somebody takes an impression, for instance, I want them to use that everywhere before they take it out of the room. So I would rather chlorhexidine over Cavicide. Pre-surgical rinses and wipes? Absolutely. Here's an example of how I use it. Every surgery, we actually have surgical drapes to keep the area clean. But that skin, you don't want any bacteria sitting in the skin, because that sort of breaks a sterility chain. So we wipe down the face, especially around the nose, the lips, and ears, and wherever you might have physical contact, and then put the drape on. So when the drape is on there, everything in our surgical site is truly sterile. interesting paper from USC. The Perry department did a study where they looked at the bacterial content of exposed PTFE membranes. And interestingly enough, some of those samples contained skin flora. Why would you expect to find them? Hopefully from the operator's hands. Because if you are touching other things, patient's ears, nose, and whatnot, the chances are you might have taken those bacteria into the surgical wound. So that is very important. So guided healing. Let's really give this a new thought, a new perspective, and let's see are the things that we're doing and taking for granted that we've been doing habitually, is it very wise or is it not? So let's rethink that, and let's see if we can use chlorhexidine or not. Thank you for your kind attention, and this is how you can get a hold of me if you do want to contact me.